Welcome back. We are here with Morgan Campbell and Catherine Sevier. They are answering your questions about healthcare enrollment, Medicare, and kind of everything in between. I first like to start out with Catherine. Can you explain the difference between Medicare, the four different parts of Medicare?
Yes, for sure. Medicare has four different parts, and they each pay for different services that you would need once you're enrolled. So, Part A is what we call hospital care. So, that is where if you went into the hospital and had a surgical procedure, it's paid for. Part B, as I mentioned a little earlier, is the outpatient care that you get from your physician, that you receive in the community, like if you needed to go have lab drawn, those types of things, physical therapy. Part D, as Morgan mentioned, is your prescription drug plan that helps to pay for the cost of drugs that you need. And then backing up into Part C is what we call an Advantage plan, and that's what we know as a Medicare managed care plan that constitutes a network around the person, and all of their care is provided through that network and their resources. Some people choose the Medicare Advantage plan because there are other services provided along with it, vision sometimes, dental, hearing, those types of things that are not covered if you have what we call the original or standard Medicare plan.
All right, thank you. Morgan, let's get to some of the questions here. First up, do I need to add coverage to my work health care?
If your work health care is deemed credible by Medicare, that answer would come from your HR department. There's no reason for you to make any changes at that point in time.
Catherine, someone's wondering, I am employed full-time with insurance. Do I need Part B?
Absolutely. You may, if you have insurance and it's a credible plan, you may choose to not take Part B at that point until you leave your employment or retire. But make sure with your HR department, because if you don't sign up for Part B when you're 65, there is a 10% penalty that is cumulative and goes on year after year after year for the rest of your life, even if you live to be 95.
What about 96?
96 too.
Okay. Just sometimes you have to throw a little joke in there. Someone texts us saying, I'm already on Social Security Disability, and I'm on Medicaid. Do I still have to sign up for Medicare? Morgan.
Okay, so if they've been on disability and they've satisfied their 2 years, they're probably going to be eligible for Medicare at that time. Even though they have Medicaid, they do need to sign up for A and B.
Someone texts, are disabled veterans whose medical care is provided by the VA, are those people required to sign up for Medicare, Catherine?
Yes, they are. And they may still be getting their care from the VA, but the VA has relationships in the community to provide some of their outpatient care, and those two programs sync together, so they still have to sign up.
Someone texted us, Morgan, and said, I turned 65 in May and spoke with a representative. They told me that because I am covered by my husband's health insurance along with an HSA and continue to work, I do not need to do anything at this point. At what point does that change for me?
When she loses the coverage from her spouse, she will need to reevaluate that and probably sign up for Part B and make other arrangements outside of her husband's employer's insurance.
Catherine, someone said we said that normal healthcare enrollment opens in a couple of weeks. Do I have to sign up for insurance?
If you're already insured and you like what you have and you're not a new Medicare person, you don't have to do anything. However, every year plans coverage and premiums change, so you may want to talk with someone like Morgan or with the SHIP program through North Carolina SHIP to make sure you're on the best plan for you.
Morgan, someone texted us saying, I am retired on disability with Medicare and have insurance through my employer which covers my prescription drugs. Do I still need Medicare Part D, or is there a better way I could do things?
If you received a letter from that employer that says that it is deemed credible coverage, that satisfies that Part D, so you would not need to do anything.
All right, Morgan and Catherine, 2 segments down, 1 more to go. Before we head to break, let's get a quick check of the forecast with Tim.